Hi, hello, and very good evening. So welcome to day one. So that's how I should say, like, welcome to day one. So this is a kind of a maiden effort started to give evidence-based medicine about yoga and naturopathy, both to the BNYS doctors as well as BNYS students, and also for common people. Fine. So here, what we are going to do is we are going to look into each and every aspects of both yoga as well as naturopathy in an evidence-based way. Right. So today for the first session, we're just going to make it really simple. We're just going to take like two therapies, right? So one is GH pack and the other one is a cold abdominal pack, and see its effect on diabetes. Okay, so as simple and straightforward as that. So we are going to take a couple of hydrotherapy treatments in naturopathy and see how they are effective. And one most important thing is we are also going to look at the mechanism point of view as well. So first I'll be presenting on GH pack. Next, Chabanwa will be talking about cold abdominal pack. And then by the end of the session, like say like 40 minutes from now, we will be looking at the mechanism of action of how hydrotherapy treatments are beneficial for diabetes. Because mostly, so whenever it comes to diabetes, the hydrotherapy treatments, what we suggest is either GH pack or cold hip bath, isn't it? So these two are the commonly prescribed therapies for diabetes, and we are going to look at how beneficial they are and what is the scientific evidence behind it, right? Okay, so now this is the paper we are going to look at today. 20 minutes of GH pack reduces blood glucose level in patients with type 2 diabetes, a pilot single group pre-post study. Fine. Now, journal club, when it comes to journal club, I know we have people across the segment, like right from first year student to a PG student to a faculty, and even principals of the few institutions are here, I guess. So now we are going into research part. When it comes to journal club, we are going to talk about the research methodology and other aspects. Trust me, as more and more sessions we get into that, you will have a better and clearer understanding of most of the research terminologies. Do not worry about like what does this pilot, single group, pre-post study means and all those things. So we are going to like get into the mechanism aspect first, and slowly with every week we'll be learning at least 2 or 3 different terms or terminologies in research. Kindly trust the process. Trust the process. It's going to be like a fun-filled learning experience, I can tell you. Right. Okay. Now, without further ado, so the authors for this paper are Dr. Muvinden, um, myself, Dr. Venugopalvi, and Sharad Chaudhary. Okay, fine. I forgot my introduction. So I'm Dr. Venugopal, yoga naturopathy consultant and a diabetes researcher with 65 plus research publications, and I'm currently assistant medical officer and lecturer at Government Yoga and Naturopathy Medical College, Chennai. Right. So I mean, what the details what you see below is that of mine. Many of you know, few of you might not know me, but still, I would like to introduce myself. So this got published in the Journal of Advances in Integrative Medicine with the impact factor of 1.7. Obviously, it's a PubMed index journal, and the publishers are Elsevier. So this is the digital object identifier, like how you want to identify a particular journal. Every journal has got this DOI. If you want to get this journal online, you can very well do it. If not, you can just ping me at the end of the session. I can share you the whole paper. Now, this is a screenshot of the paper. Right. Okay. Now, going into the paper. Now, what we are going to do is we are going into the structure of the paper. Right. So abstract. Now, first and foremost, how a paper should be, how to write a paper. Now, the abstracts, as I generally say, abstract is like the trailer of a movie, right? So it is like a trailer of the movie. Before going into the movie, we watch the trailer, we watch the teasers. Only if it is good enough, we will go to the movie, right? I mean, of course, we will look at the review and other things as well. Similarly, before reading the whole research paper, what we generally do is we will study the abstract of that paper. Okay. So now whatever contents present in the abstract is very, very important for the readers to go through the whole paper. Fine. So here the abstract is structured abstract. There are two types of abstracts. One is the structured abstract, the other is the unstructured abstract. Unstructured abstract would be like they'll be writing like a story without head or tail, they'll write the whole story. Structured abstract is it will be having individual components. Like as you can see here, it will be having a background, materials and methods, like how the study was conducted, where it was conducted, and what tests did they analyze. If they are going to say like to see the effect of Brahmari pranayama on blood pressure, they'll be seeing like on how many patients they did that, and with what age group they did that, all those information, what did they measure, and all information would be there in the materials and methods. Then we'll be having results, whether the blood pressure reduced or not, and finally the conclusion. Now, here in this particular study, what we are looking at is we are looking at blood glucose changes with GH-PAC. So the background is about diabetes. Okay, we'll just go into the main paper. And the main paper starts with background, right? So the background starts with diabetes prevalence, right? Diabetes prevalence. Okay, now this again can be told in like a story, in the story format. Okay, so if you're watching a movie, fine. So if you're watching a movie, first there will be the villain introduction. The villain would be introduced in the scene, like how bad he is, like how horrible and how terrible he is. All those things would be introduced first, and then comes the hero entry. Okay, so first here the villain is diabetes, the villain, right? Diabetes is the villain. So the background starts like the prevalence of diabetes, like how many people are getting affected with diabetes, with the complication and stuff. So here they talk about diabetes prevalence to be like 425 million people affected with diabetes, and 629 million people would be affected by 2045. And then we are just introducing the hero. The hero here is the hydrotherapy treatment modality, right? So how we are introducing the hero is like previously people used to have like more of medicine related things for the diabetes management. Now people are starting to move towards CAM therapies. And talking about the CAM therapies and the non-pharmacological therapies, hydrotherapy is one such therapy, and GH-PAC is a hydrotherapy modality. So that would be the villain introduction. That's about the diabetes. And then we are just going into the hero introduction, which is nothing but hydrotherapy, naturopathy, GH-PAC. Right? So GH-PAC is the main hero. Like we are talking about the background of the hero and what he studied and all these things. All right. Now, second thing is materials and methods. How the study was conducted, just like the plot of the movie, right? The study design. Excuse. Okay. Now, talking about the study design. So first and foremost, we just mentioned as institutional ethical committee approval was obtained, right? As this was a research study, we are using like patients as research participants. So every institution would be having an ethical committee. It is of utmost important to get approval from them before starting a study. As I said previously, this might be very rudimentary for a few. There are a few researchers and PG who are listening to this. You might think like everyone knows that, but still we are having first year and second year students who are interested in research and evidence-based medicine. So let me just touch upon them like every like what to say. Whenever I get an opportunity, let me just tell a bit of basics as well. Now, ethical committee, talking about ethical committee, the ultimate aim or the objective of the ethical committee is that, like say I'm going to find a drug, I'm going to find a medicine for cancer. Okay. So now before getting that medicine into the public, what I have to do is I have to test it on patients who already have cancer. So that would be logical. So I have to try that in 10 or 20 or 50 or 100 patients first. Only if that is beneficial, I can give that to thousands and lakhs of patients. Okay. So this is how medicine comes into market. Now imagine if the medicine which I make might probably affect this 50 or 100 people in the what do you call in the study or the research group. Okay, the 50 or 100 samples, if they get affected, it doesn't matter whether the medicine is useful for lakhs and crores of people, ethical committee will not approve that. Okay, their main aim, their main objective is that the study participants, right, the research participants should not get affected. Okay, should not get affected both physically, mentally, or emotionally. They should not be getting affected. And that's why, like, most of the ethical committees will be having religious people on board. There should be at least one female ethical committee member has to be there, so that the women rights, the emotional aspects, and other things are taken into consideration. Okay, so on all the spheres it would be useful. Now, why this concept of ethical committees came is because of an interesting story. What happened with after Second World War is that, like, Second World War, we know like how much of what to say, the problems it created, and like what Germany did to the whole world. Now, what happened at that point is there were German doctors who started conducting research on the war captive. They captured the soldiers from the enemy countries, and they started doing research on them. How to do the amputation part, how to just put two legs back to, on each other. All this thing. They used to cut the leg of the patient and try to attach it with another leg. Fine. I mean, we are talking like about like 80 years back. Even though that has got benefit for lakhs and lakhs of people in the future, but still the samples and the participants in that research group, they are getting affected because they don't have like any anesthetic or any other things. They don't even know whether they will survive that or not. So that is the ultimate aim of ethical committee, and every institution should have that. Now, so this ethical committee approval was obtained from, and this study was done at Vyasa University, Bangalore. So ethical committee approval was obtained, and this is a pilot study, right? So pilot study, it's a pre-post study without a control group. We just want to see whether GH-pack works or not. Okay, we want to see whether GH-pack works or not. If it works, then we wanted to have a control group. Then we wanted to have a larger sample size and write it for research funding. Okay, because the experiment is a bit costly. I'll just tell about that shortly. So for research funding, that was the ultimate plan, but because of COVID, we're not able to carry on with that, right? So this was just a pilot study, which was done only on 8 patients. Okay, so the GH-pack duration was for 20 minutes. That is the, I think that is the standard GH-pack duration across all the institutions as such. So it's given for 20 minutes, and I'd given it 4 time points. That is before putting the GH-pack, immediately after, 15 minutes after, and 30 minutes after GH-pack. So this is one of the uniqueness, we can say. It is not like before and after. We did not just measure only before and after. We also measured immediately after, 15 minutes after, and also 30 minutes after. I mean, I'll just explain why we took 4 time points shortly, right? And the participants' age, like average age is around 51 years, plus or minus 5. So inclusion criteria is, who are the people I'm going to select for the study? Who are the people I'm going to avoid for the study? That is what we call as inclusion and exclusion criteria. Am I going to take only the diabetes patients? Am I going to also take hypertensive patients? Am I going to take people with cardiovascular diseases? Whatever it is, whatever I want to include in, I'm going to put that in inclusion criteria. Only type 2 diabetes patients. It was plain and simple and straightforward. But in exclusion criteria, I had like we excluded people with diabetes complications, so that, I mean, we don't even know whether it works for diabetes. So we just excluded people with complications, and other types of diabetes like type 1, type 1.5, LADA, MODI, all those things we avoided. And people with fear or phobia of hydriatic applications, like hydrophobia. I would have heard about hydrophobia in rabies. So that is like kind of an extreme case, but still again, so fear or phobia of anyone with psychiatric illnesses, we just excluded from the study there. And intervention. So intervention is GH pack. Most of us know what GH pack is. So what they do is like they put a hot water bag over the abdomen, temperature 38 to 40 degree, an ice bag over the lumbar region, 1 to 2 degrees centigrade, and wrap the patient's torso or the abdomen part of the core muscle area with a cotton cloth first, and then followed by woolen blanket. Okay, so this is the GH pack, which the patient would be there in that position for 20 minutes, right? So that is the intervention. Now, the outcome measure. Fine. Fine. So if you're just going by the plot, we just had this hero introduction, which we had mentioned in the background. Then it came the methods, materials and methods. Like hero and villain are going to fight now. GH pack is the hero, which is going to fight against diabetes. Okay. Now, so we are going to mention about like GH pack. We are going to mention about the hero. This is the hero. But at the end of the movie, we should know whether the hero won or villain won. Okay. Who won? Whether it is the hero or the villain. And how do you say or how do you measure whether the hero won or villain won is through the outcome measures. Whether the hero died or villain died. Did the hero forgive the villain or the villain just changed by himself? All these are the criteria. This is what we call as outcome measures. If you're doing for diabetes, like any intervention for diabetes, we can measure oxidative stress, we can measure inflammation, we can measure sugar levels, we can measure even BP levels. These are different outcomes. Just like in a movie, it is not necessarily whether hero dies or villain dies. It could be like a hero forgiving the villain, hero forgiving the villain family. Okay. Now, even hero can become a villain by the end of the movie, whatever it is. So there are different outcome measures. These are the different outcome measures. For this particular study, the outcome measure, what we had used was, we measured blood glucose levels at 4 time points. I mean, as mentioned before, but the uniqueness of the study is that we use this continuous glucose monitoring. Now it is getting very famous when it comes to diabetes reversal. Like it's the funny part is people are saying like this is the one which reverses diabetes, and we know about the glucose excursions and other things. Trust me, I'd used this device like 7-8 years back for my PhD. And okay, fine. I mean, let's not go into the glucose reversal part, diabetes reversal part, and other things. So this continuous glucose monitor measures blood glucose level every 15 minutes, right? So it measures blood glucose level every 15 minutes. And this like, it would be in the shape and size of a 5 rupee coin. And that would be sticking on your upper arm, like non-dominant, usually non-dominant upper arm. What it does is, it will be having like a very thin wire. It will be having a very thin wire, and which would be in your interstitial fluid. It's not going to prick into your directly into your blood vessel. It will be measuring the blood glucose levels from your interstitial fluid. Okay. So it's factory calibrated. You don't have to calibrate anything and do this thing, that thing, nothing. You just put it for an 15 minutes to an hour. It will start calibrating by itself. And whatever reading you're getting through a scanner, it will directly tell your blood glucose levels. It's all calibrated part. Okay. Now, why we use this? Why can't we just simply prick the patient and get the blood results done? Why? Because as I said before, we used at 4 different time points. Why 4 different time points is, remember when we are taught hydrotherapy, we'll be talking about 2 things, action phase and reaction phase, isn't it? We have this action phase and reaction phase where we ask the patient to sit in the hip bath tub or like a GH pack or whatever. When they're sitting in the hip bath, say for example, when they're sitting in the tub, there will be constriction of blood vessels in the skin periphery and dilation of the blood vessels inside of the visceral organs. And during the reaction phase, what they say is when we come out, the reverse happens, right? Now, our hypothesis was that, first hypothesis is the blood glucose levels reducing or not? That we have to know first, because GH pack, we don't even have like 3 to 4 research papers published in PubMed Index journal either in GH pack or in cold hip bath or in cold abdomen pack. Okay. If you are thinking of writing a paper, if you are thinking of doing a research, don't think like extremely high thing. I want to do a Russian bath or Turkish bath, was never done before. There's no study which is like very, very unique, which has never been done in the world before. It doesn't matter what study you do. There's someone in some corner of the world would have done it, right? The thing is whether it got published. Until and unless a paper or a research work is not getting published, it's not going to serve the purpose. It's not going to serve the world. A doctor can serve people in the community, like in a specific hospital or in a clinic, he can serve like 50 to 100 people or even like 500,000 people. But if a researcher finds something and gets it published, that is going to help lakhs and lakhs and lakhs of people. So that is the reason we urge for people to write the case reports and case series and other things. Why? Because whatever you're finding, whatever we are finding at our hospitals and clinics are really amazing. Really, really amazing. We are getting from yoga naturopathy hospitals across the country. But our problem is that we are too lazy to get it published. Right? So that is that is one of the ultimate aim and purpose and objective of this series of journal club presentation, what we are planning on Monday evenings, to just sensitize about the importance and to sensitize about the evidence-based property of yoga naturopathy. It is not like some grandmother tales or anything of that sort. Whatever we are doing in yoga and naturopathy is absolutely scientific, and that's what we are going to see like till the World Naturopathy Day, right? Okay. Now for hydrotherapy, we talk about both the phases, that is action phase and reaction phase. First thing, sugar level has to reduce. Done. Okay. So there are no previous studies. We just want to see first sugar level is reducing or not. Then the second question is, when is the sugar levels reducing? Is it when the patient is sitting in the cold hip bath, or when the patient is having the GH pack, or is it after the GH pack we are getting that result, right? So that is one thing, whether the action phase is producing result or is it the reaction phase which is giving the result. That is the second objective of the hypothesis. And the third one is whether this is helping in insulin secretion or whether it is working in insulin sensitization or to reduce insulin resistance. So these three are the main objective, because sugar level is reducing. How it is reducing? How it is reducing? Whether the treatments are helpful in increasing insulin secretion, or is it beneficial in insulin resistance? So these are the questions we had in the mind, and that's why we took at 4 time points. Okay. And as far as statistics is concerned, we did an RM ANOVA. Okay, fine. Anyway, we'll go directly into the results. Now, this is the graph of the results. Okay. This is like the baseline one. Fine. So this is the baseline sugar level, which is somewhere around 160. This is like mean, the average one, right? And when GH pack was being applied for that 20 minutes duration, that is minimal, that is reduction, but that's only minimal reduction. But immediately after, so that is at this time point, like around after 20 minutes, what happened is that is a reduction, and that is a significant reduction. So that's why this 1 star denotes p-value is less than 0.05. That is significant. And after 15 minutes, there was a very significant reduction. There was a very significant reduction. But after 30 minutes, it was like almost like straightforward. Okay. There's no much difference or no much change between the 15 minutes report and the 30 minutes report. Okay. So now this gives us, this answered a lot of questions. This actually answered a lot of questions. First and foremost is it's not during the GH pack we are finding the results. It is immediately after. One thing. So that is the reaction phase is having an impact. Fine, these two parts, the reaction phase is having an impact. And the third objective, what I was mentioning is whether it's because of insulin resistance or insulin secretion. It cannot be because of insulin. It's mostly because of insulin resistance. It's overcoming insulin resistance. If not, this decline would have gone this way. That is, if it is increasing the insulin secretion, and as a result of that, it is what is it doing its role of insulin, glucose disposal, means this line would have come down all the way here. If it is flattening out here, means whatever insulin has been there, that's been getting utilized. Okay, so the discussion about that. So GH-PAC possibly increases blood flow. This is the possible mechanism that was postulated in for this study, right? A little bit of elaborate and comprehensive mechanism I'll just tell during the third part of the presentation once Chaman Baba finishes the next presenter. Okay. Now the discussion part, the GH-PAC possibly increases blood flow to the visceral organs. Now why? Because we have an hot application in the front and the cold at the back, right? So what happens? So the GH-PAC possibly increases blood flow to the visceral organ. It could be the liver, pancreas, or the abdominal muscle, and facilitate glucose metabolism through thermoregulatory changes. We will look into the thermoregulatory changes in the elaborate mechanism part. Now, this is facilitating glucose metabolism, means it's working on insulin resistance primarily, right? So because it's focusing on liver, it's improving circulation on the liver. Liver is the major organ to be worked on when it comes to diabetes. It's not just pancreas, right? Liver is one of the major organs that need to be worked as far as diabetes is concerned. And so in GH-PAC, what happens? We did not, like this study only measured the blood glucose level. We did not look into the circulatory changes, what's happening inside the liver. We did not look into the any liver enzymes or the markers. So this is just an hypothesis as such, right? So because of that, through the thermoregulatory changes, it has an impact, one thing. And again, like the heart has got this property of dilation of the blood vessel, increasing the skin activity and glucose utilization. So our hypothesis was GH-PAC might possibly improve insulin sensitivity than insulin secretion. As I said, like if it had any impact on the insulin secretion, the graph would have dipped like this. Okay. Again, now this can only be concretely told, this can be concretely told only if we measure insulin levels, right? So as a diabetes researcher, as a researcher, I have to emphasize that until and unless the specific test has been done, we cannot claim that GH-PAC improves insulin sensitivity. GH-PAC does not increase insulin secretion, because we should have measured the insulin levels as well. If you had measured the insulin levels at baseline, at this point, and this point, at this point, then we can say, we don't have to use that word might. We can say GH-PAC improves insulin sensitivity than insulin secretion. Okay, right. So this is what this particular paper talks about the mechanism. Okay, and I was not completely happy or convinced with these steps, whatever we had mentioned, right? So let me just present you another paper along with like a few other related papers to tell you how the mechanism of action of hydrotherapy treatments work. But before that, so we'll have the second presenter now. Okay, the second presenter. Now the best part is the second presenter is actually a first year student. Okay, he's a first year student. I'm feeling really proud that first year student, he came forward and told that I would like to present. In spite of a group of like all the senior doctors and other people, he came forward and told like he wants to present, and I'm looking forward to see his presentation. So after 20 minutes, we'll just get back with the one sec. Yes. After 20 minutes, we'll just start with the mechanism of action of few other papers. That is hardly like 4 to 5 slides. Okay. Right. Shaman Baba, are you here?
Yes, sir.
Yes. Are you ready with your presentation? I've given you access to share screen. I have made your co-host. You can share screen.
Sir, for a few minutes, sir.
Okay, for a few minutes. Time is precious. Yes. Good. If not, I will start presenting then. Let me paste the DOI of this particular paper in the chat. If you want to read into the full paper, you can very well do that. Actually, wanted to start a group and then share the links and other things, but it's becoming like too many WhatsApp groups, and I mean, it's getting difficult to handle them as well, right? So what we will do is, any questions or queries, just kindly put it in the chat box right now, so that the moment we finish the other two, what to say, the couple of presentations, after that we'll take the questions and start answering them as well. Okay. Right, Chabanaba, let me just finish the mechanism part as well. Just get ready with your stuff.
Sir, you are disable the screen sharing option, sir.
Okay. Fine now?
Okay, sir. Still, it's got disabled, sir.
You're the host now.